Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. We have an exciting show lined up for you. Let's get right to it. So we first highlighted the work of our next guest 8 years ago, and he is back on to give us an update on his research in helping stroke victims regain normal walking ability. So joining us right now is Dr. Kyle Reed, Assistant Professor in the Department of Mechanical Engineering at the University of South Florida. Thank you for joining us, Dr. Reed.
Nice to be here. Thanks for having me.
Certainly. So the research at the Reed Lab at USF focuses on haptics and rehabilitation. Can you go ahead and explain what that is?
So those are two different areas of research, but they have a lot of correlations to each other. Haptics is all about the sense of touch. So anytime that you're interacting with something and touching it, you're using your sense of haptics. It's also called tactile interaction, more commonly in the media. And that's looking at how people interact with devices. And my research on rehabilitation is looking at how can I use devices to help people regain abilities after stroke, really focusing a lot on gait. And so those two actually work really well together because one is looking at improving people that are unimpaired, that are generally healthy, to have better interactions with devices. But the rehabilitation is looking at people that have some sort of limited mobility, some sort of impairment. And so really, I'm just looking at increasing everybody's abilities. And there's a good crossover. Sometimes the stroke research helps the haptics and the haptics helps the rehab.
So bring us forward to now versus what we saw, 7, 8 years ago. What have you been up to? A lot.
8 years ago, we were really just kind of getting the design figured out. The fundamental design has not changed much, but what we've been working on is making it more robust so that it can last a lot longer. And so since you were last there, we've run 2 clinical trials and with stroke patients. We've had about 27 patients on it. We've also done one that was at home. And I've started really working with a company called Moterum. They're the ones that are taking this device and bringing it into the hands of people that need it.
Well, and describe how that shoe works, how the iStride works, because if I remember correctly, you wear it on one foot and it almost looked like a roller skate. Explain if the design has changed and then explain how and why it works, if you would.
And you put it on the good side, I think.
So that's the unintuitive part of this is it is really designed to go on your healthy foot. So when you have a stroke, you basically get one side that's impaired and one side that is generally unimpaired because of the way that the brain is sort of split and it affects one side. And so you put this shoe on the good side, and what happens is when you step down on it, it has these sort of spiral-shaped wheels that push the foot backwards. And so the original premise was based on something called a split belt treadmill, where there's 2 treads moving at different speeds. And it works really well if you stay on the treadmill, but the split belt treadmill doesn't really have a good transference from that treadmill environment to over ground. And so this shoe allows you to walk with that same effect while walking over ground. That's the beginning of kind of where it started from. But we've actually found that there's a lot more benefits to it than just having that backward motion. So some of those other effects are it adds a weight to one foot. And so that asymmetric weight has actually been shown separately to benefit gait. And so it can be used, in some cases, they'll put a weight on one leg, and that will help to asymmetrically correct your gait pattern. Similarly, it adds a height. And so as you step down, that foot is a little bit higher, and it changes the height between when you first step down and when you let go of it. And another very interesting aspect is because what Kimberly said, we're putting it on the healthy foot, the shoe actually destabilizes you. And so you can imagine that if you put your foot down and it's suddenly being pushed backwards, that's going to not feel as stable as it would otherwise. The benefit of that destabilization is we don't actually want them to be standing as much on their good side. We want them to spend more time on their impaired side, because that old adage, use it or lose it, really applies. If you don't use your impaired side, you are going to lose those abilities. So having it be destabilized encourages more use of that impaired side, which really aids in the walking abilities.
Now, once they use that iStride shoe, they keep what they gain, correct? They don't regress, right?
Yeah, so we actually just had a paper published about a month ago that was showing 1 year follow-up. And so what we found is after they used the shoe for, it was 12 sessions over 4 weeks, they had an improvement in their gait speed of 0.27 meters per second. Now, just for context, most healthy individuals walk around 1 to 1.1 meters per second. And so we brought them up, not all the way to 1.1, but they passed this threshold where they are now able to walk around and not feel like it's going to take them forever. And so what happens is there's this 0.8 meters per second threshold. As you're walking or thinking about, I'm going to go get mail, if it's going to take you 5 minutes to get to the mailbox and come back, you're going to say, I'm just going to have someone else go do it. Mm-hmm. And then you're going to sit on the couch and you're not going to walk. Well, what we found is we surpassed that. So people said, let me go walk out to the mailbox. Let me just walk to the end of the block. And one of the patients actually said, I was walking with my grandson, and next thing I knew, I was at the park. I haven't walked to the park since I had my stroke. And she wasn't setting out to do that. They just were going for a little walk, and suddenly they were there. And that's the reason why they're able to maintain such a good outcome. And so when we tested them a year later, they had retained almost all of that same walking improvement. And many of them were walking, continuing to walk. And that's how you're going to get better, is by walking.
Didn't one of them deal with a woman down in Mexico, I believe? And when the story came out, Kimberly sent it to me, and that we're like, oh, wow, that's Dr. Reed. We know him. He's in our backyard at USF. Tell us about this woman and how iStride has helped her, if you would.
Yeah, so Maria, or she goes by Elena, she had a stroke about 3 years ago. And this was kind of during COVID, so it was hard to travel. People weren't, her kids weren't able to go travel her very much. And so they were kind of getting a little concerned about her. So they started looking into different research therapies, and they came across the iStride device. They contacted Moterum Technologies, the company that I work with, to commercialize it. And when they reached out to her, they kind of came to this agreement that said, we'd really like to help you. And so they actually brought her to the US. So she stayed here for a month. We brought her here. We were testing her. We did all the normal 12 sessions over 4 weeks. She had such a good attitude. She was so just grateful for this. But also her abilities changed just tremendously. One of the huge difficulties is she has 120 steps up to her house. She can't walk that by herself since her stroke. But as soon as she got home after the therapy, the story that you're talking about, the USF released, they had this video showing her walking up the steps. And the best part is just the elated smile that she has when she gets to the top and she actually starts dancing. Daughters had said they have not seen her dancing since her stroke. And so just the joy that she was able to have again was just very heartwarming.
Beautiful. Yeah.
It's got to hit home with you and be such heartfelt pride at that point to know what an impact you're making on these individual stroke victims' lives.
It's trickled out because of all the benefits it's had for stroke patients. Mm-hmm. Some of these stories have gotten back to the patents and licensing team and the media team. And I've heard from them that this story and hearing about some of these things really just drove home the importance of what they do. We're really hoping that we can get this into the hands of many, many more people the next couple of years.
We hope so, too. Thank you so much for being on the program, Dr. Kyle Reed. We'll be back after the break. Make sure you stay tuned. You're watching American Medicine Today.
2 neurosurgeons couldn't figure out anything that was wrong with me or what I would need surgery for. Dr. Bonati, without even seeing me, knew I was hurting, knew they could help me. First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Visit AskBonati.com.
It's just amazing. This is amazing. This is what I came here for. I can't wait to see what what happens next with them. I mean, this has just been 10 days. Dr. Bonati's was the first hand I shook. Yeah, man, he's good. I got too many no's that they couldn't do nothing. And I got a yes. How many times you want to watch these videos before you get off the couch?
David is a recent patient of Dr. Bonati and is now on the fast track to recovering. However, before coming to the Bonati Spine Institute, he spent years in pain with physicians near his home offering him just one solution: traditional open back surgery with fusion hardware. David underwent 3 fusions over the years, resulting in a condition known as claw hand.
I started experiencing muscle spasms in the middle of my back. The muscle spasms got so bad that, they were just driving me crazy. The symptoms were just all pointing to pinched nerves in my neck, bad discs and everything, so it's got to go in there and fuse them. I regret, but I had it. They went in from the back. Well, a couple of the screws weren't right on, and it affected the nerves. Well, it was about a month after my C7T1 that I was holding my right hand up, showing it to them, going, is there something wrong? And it developed. My hands were aching for a while, and then they just started really just getting really clamped up. Days were stuck and curled. I can only do so much with my hands. I do the best I can. And they're like, hey, you got to wait 18 months because we don't know if you're healed. It's got to go 18 months. Well, 18 months went by and I'm still holding this hand, showing it to them. And, they just didn't want to deal with it.
These surgeries not only failed to eliminate his pain, they made him worse. David then had no choice but to start taking opioid medications.
So things just kind of diminished from there. Before you know it, you're at the bottom. Because of my upper back, when they put them pinnacle screws in, I lost my posture, so you hunch forward. Well, 3 years of that, walking hunch forward, I herniated 4 discs. So not only did I have problems with my upper thoracic back with my hands, which I've been dealing with, my lower back was out. So, it was game over, really. I'm trying to cope with this mentally, physically, emotionally. You know what I mean? It's horrible. You can't cope. You don't know how to manage. It's just, you try. But, it slips away. Oh, man, it was tough, I don't know. You don't want to be there, But you got to make a decision. So.
Desperate for a solution, David started searching the internet for answers.
I was on YouTube, just looking for any kind of information on how to get better. I found Dr. Bonati, a clip on him, and I started looking more into him. And once I found that, it was like every day I'm on YouTube looking at all the testimonials. And it was like, wow, man, I got to get my stuff over to him and just see. And, it was probably the best move I ever made.
Inspired, David sent his imagery for consideration. Dr. Bonati called him personally to let him know that he was a candidate for the exclusive Bonati Spine Procedures.
I sent the MRI and the x-rays, everything over to him, and I got the phone call. And then he confirmed what I was feeling and thinking all along, that there was a problem with that one right side hardware wasn't right, and it had to come out. My surgeon couldn't do it. I was told that it can't be done, and that my back would collapse if it was taken out. And here's a guy that personally called me and said, hey, here's your problem. He was telling me what I was experiencing, and, I don't think, some of the stuff I don't think I could have said better. Sometimes you don't know how to say it, because there's nerve pain, there's other kinds of pains, and you got to try to separate it. If it's nerve, it's where it is. And, telling him what I've been through, he could almost picture where these problems are.
Hearing there was hope for him, David made an appointment for an in-person evaluation. After a thorough physical exam, he made his way over to the on-campus imaging center for updated x-rays and MRIs.
You're walking into this place and you're just hurting and you're just looking around, taking it all in. You know what? You made the right move. The first step was getting in the door. We did some tests. They wanted to make sure I was good. He wanted to see himself. I had a lot going on. I knew I was in trouble. I didn't know how much. Yeah, we had a lot of x-rays, and boy, they went after everything, every angle.
A few minutes later, David met with Dr. Bonati to review his new images and create a customized surgical plan to eliminate his pain.
I gotta say, I didn't know that I had claw hand until about 2.5 months before I got here. You know what I mean? Because these hands were curled right over. And I'm talking, going to the hand doctor, right? Went to there. It's in your neck. It's in your neck. But they can't fix my neck, remember? There's nothing they could do. And then Dr. Bonati sees it, and he's neutral. He's going to tell you what it is. You know what I mean? And luckily, I got here in time, because I don't know how long I could have stayed like that. I'll be honest with you, 3.5 years living like that. And it just totally lost. What a waste, you know what I mean? But you get caught in this, and you don't know what to do. What should be your next move? I would have done this years ago.
David required multiple Bonati Spine procedures to address issues in all levels of his spine, including fusion hardware removal. At the Bonati Spine Institute, surgeries are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon. This is to ensure the source of the patient's pain is eliminated before they leave the operating table.
It wasn't that bad, really. I was just so relieved. I mean, to come out of that operating room and feeling my hand, the degree of pain, because it always stung, it always hurt, and it didn't. It's just amazing. It was one of those studs, was definitely affecting everything, and it was the whole problem.
Oh my God.
No pain here?
No.
No pain here?
No.
No pain on the hip?
No.
Okay. No pain on the foot?
No.
No numbness?
No.
Okay, good.
As soon as the hardware came out on the right side, I mean, it was just like, phew. So, amen. It happened,
He is better.
Any pain?
No, I'm not feeling it, man.
What about that sensation you were having through here?
None of it.
Don't feel that at all?
None of it.
Good.
Not at all. I can tell you already, I'm going to do better. I'm going to do a lot better grabbing.
Your recovery time is quick, and you're going to walk out that door. I mean, yourself. You're not going to. It's nothing like a regular surgery where you're all screwed up for days on end. I gotta say, but when I walked out that door, I could tell a difference in my hand. It was immediate. And it's been 10 days today we've had that. And each day I just got to look at my hand and just like, wow, I can feel my toothbrush. You know what I mean? Because you can't. When your hands are in claw, you can't even hold a toothbrush. You know what I mean? Let alone a pen or a pencil. Well, here we are.
Now pain-free and with the use of his hands restored, David is looking forward to living his best life and highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I would recommend Dr. Bonati in the Spine Institute and his whole staff to everybody. I'm just so looking forward to be able to get up in the morning and go outside and do something and not have to take a pain pill. I just want to go back to work. I just want to do what I do. You know what I mean? I just want to get up in the morning and go fishing if I want to.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store. Welcome back to American Medicine Today. I'm alongside Dr. Bonati. Why don't you tell us what the general population is that comes to be treated at the Bonati Spine Institute?
The majority of the people who comes to see a physician in orthopedic surgery or in neurosurgery, from every 10 of those patients, 7 of these people are associated with back and neck problems.
That's crazy.
If you go to a family physician or a general internal medical doctor who has no understanding of the pathology, understands the pain, understands the area that is affected, understand what are they going to do with, but they don't really understand why that is happening. Not everyone, but the majority. Patient come to me and said, I have a hip problem. And my general practitioner sent me to an orthopedic doctor.
Right.
And they did some tests on my hip, some x-rays and some MRIs. And they think that I have a labrum tear or some degenerative tear. And the solution, but sometimes, is we need to replace your hip.
But they're guessing. If they may have, then that means that they didn't find anything specific to show that. Is that a correct assumption?
Usually, when you look at the report of the radiologist,
right,
the radiologist usually finds something.
Okay.
All right? And if you are 65 and older, you have some changes on the hip, you have some changes on your knees,
right,
and you have some changes on your back. If by any circumstances you, and I'm talking to you as a patient, okay, you come to a general practitioner and the general practitioner talks to you and said, you have bad knees, that's why you're hurting.
Right.
I'm going to refer you to an orthopedic surgeon. That's okay. If you go to an orthopedic surgeon, they're going to take X-rays and they're going to take an MRI. And the radiologist is going to come with a little findings there because, hey, you are not 20 years old. You are 60 plus. That little damage there will depend now on the ethics and responsibilities of the doctor who is seeing you to investigate further there. If you don't have a clear knowledge of a spine, you really are not investigating the area well. 90% of the patients that they come to us, the pain is like this. Pain on the back, chronic. That means they hurt every single day. Pain on the hip, chronic. They cannot sleep, they cannot sit, they cannot walk. Pain on the knees, not so much, but they cannot go up the stairs because the leg is not strong. They cannot come downstairs because they're concerned about it falling.
Yes.
These patients also, they lost their balance. So they are exposed to horrendous type of falls if they're living in an area that they have stairs. In the streets, one step off the curb without balance, you're going to go on the floor and break your wrist or really break your hip. Mm-hmm. When I was in training, in the morning of every Saturday, we have 3 or 4 hip fractures that we need to repair.
Right.
And that was every time a fall. I never understood why these falls broke the hips. It's because the patients, they didn't have a good balance. So the fall was terrific fall. Mm-hmm. But the problem that I see with this is, and where I'm going, is that you need to do a proper diagnosis. And if you go and you look at the 4-5 level in the vertebrae, the 4 lumbar vertebra and the 5th lumbar vertebra, you're going to see that you do have some type of an abnormality that is the cause of the hip pain.
Mm-hmm. We're going to take a short break and continue our discussion with Dr. Bonati about the population that comes into the Bonati Spine Institute.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know, so 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back. We're continuing our discussion about the population that comes to the Bonati Spine Institute for treatment. So what happens in that case is somebody has a hip replacement surgery because they listen, they're still going to have that residual pain because they're not correcting the condition.
Well, not really. When they go and they are going to, if they replace the hip, they will remove the nerves that they are going to give you that sensation.
Okay.
So you are going to have a situation where your hip is not going to hurt.
Okay.
But you didn't remove the pathology that they create that hip was hurting.
Sure.
So the nerve still is active, and you're going to have a residual pain on the hip despite that you do have a hip replacement. And if it doesn't hurt, you are going to pound that hip because the nerve is not going to give power to the muscle.
Right.
And the muscle is not going to become a shock absorber. So you are going to pound the replacement hip every step that you do. And when you do that, in around 5 years, that hip is going to be destroyed. But they need to understand that if you correct earlier that problem on 4-5 and you free the nerve would give the information to the muscle 100%. And the 100% to the muscle will create in a muscle the power that you need to become a shock absorber. So your hip is not going to be destroyed. But you need to identify that one earlier.
Right.
Your surgeon, your orthopedic surgeon or neurosurgeon should know that.
Right.
And then say to you, you don't need any replacement. What you need is to correct that. And if it is too advanced and it really needs to be a replacement, you replace, but you need to do the procedure on the back, because if you don't, you're going to destroy the new hip.
It's like I've always said, if they take off the blinders and really look at the entire patient, not just one specific area, you start to see where the problems are stemming from. And you do that at the Bonati Spine Institute. If you want to find out more information or see if you're a candidate, you can go to askbonati.com. And thank you for watching our show. You can catch us anytime, anywhere on your streaming apps. Search keyword AMT. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.